Researchers at Boston Children's Hospital and Brigham and Women's Hospital have teamed up to create the Boston Center for Endometriosis, a first-in-the-world center for care, research, and education. As the first step towards researching women's health issues across the lifespan, the Boston Center for Endometriosis is funding the Women's Health Study, From Adolescence to Adulthood. Researchers from the study are creating a biorepository and database to serve as a major resource for researchers and investigators. A biorepository holds a collection of samples like urine, saliva, blood, tissue, and peritoneal fluid that are stored for future research. The database contains de-identified information about donors. Participation is fairly simple and can be completed at home. You will be asked to fill out surveys about your medical health history, family history, and recent life activities. This information is essential to our database, which will help grow and foster research. You will also be asked to provide saliva samples. We will ask participants for one urine sample. Most will do this during their doctor's appointment and choose to donate the rest to the biorepository. Others may also choose to do this at home. All samples collected at home will be mailed back. Participants may choose to give a blood sample at the time of a medical appointment. If you have blood work ordered by your clinical provider, we are able to do the research blood sample at the same time to avoid a second needle stick. Some patients undergoing surgery are also eligible to donate samples of tissue and peritoneal fluid, which is the liquid found inside the abdominal and pelvic cavity. There is no intervention aspect to this study, meaning that there are no treatments provided as part of study participation. We will not ask you to change anything you normally do, such as medicines you take or foods you eat. We would also like permission for the Women's Health Study staff to contact you in the future. In order to monitor changes over time, we would like to obtain updated health information, saliva, and urine samples once per year. If you decide to enroll in this research study, you will be assigned a study identification number. This number does not contain any information such as birth date or medical record number that can be used to identify you. All of your samples and survey answers will be labeled with only your study ID number. If samples or database information are shared with researchers, they will be identified only by the unique ID number. There is no scheduled date on which these samples and information in the bank will be destroyed. Your samples may be stored for research until they are used up. There is no direct benefit to participating. We believe participation in the study may help us to learn more about issues that affect women's health. You will pay nothing to take part in the study. All participants will receive the choice of a $25 gift card from a major store or online retailer the first year they participate. The participants completing a blood draw will receive an additional $10 gift card because of the added time blood donations take. To thank you for your continued participation each year you complete the follow-up survey and samples, you can earn up to an additional $20 in gift cards. Participation in this research study is completely voluntary. You do not have to participate in the study and may also choose to participate in the research and then stop. You have the right to withdraw from the study at any time. If you would like to participate in the study, you will speak with a member of the study team who will read through a research consent form with you and answer any questions you may have. This will happen before you begin participating in the study. Thank you for your interest in the Women's Health Study sponsored by the Boston Center for Endometriosis. For more information about study, staff, and research participation, please visit our sponsor's website at www.bostonendometriosis.org.